Committee on Health and Welfare, meeting number 2. The date is Thursday, September the 9th, 2021. Madam Clerk, please call the roll.
Senator Rocky Adams. Senator Berg.
Present in the room.
Senator Carroll.
Present in the room.
Senator Givens. Senator Harper Angel.
Present in my annex office.
Thank you. Senator Howell.
Present in the room.
Senator Kerr.
Present in the room.
Senator Meredith. Senator Nemes.
Present in the room.
Senator Wise.
Present in the room.
Chairman Alvarado.
Present. All right. Well, thank you all for accommodating this meeting on the fly. This is Senate Joint Resolution number 3, which was filed a couple of days ago, and it's a joint resolution establishing that the Commonwealth of Kentucky will recognize a positive COVID-19 antibody test as equivalent to having been vaccinated against COVID-19 and declaring an emergency. I don't know if anybody's had a chance to review this. Like I said, I filed it on the first day of special session. We heard some testimony here last week, I guess now. I'm trying to remember the days. Things have blurred together. But a good testimony from a lab and a Dr. McConnell, who was a cardiovascular researcher who's done a lot of study on immunology and works with a company called Aditext, and had referenced a study which you all should have before you in terms of trying to measure neutralizing antibody levels. We know that there's a lot of people out there. We heard a lot of testimony during that time that there's people that have received the vaccination for COVID or a vaccination for COVID-19 and think they're protected. People that have had the actual infection think they're protected. People who perhaps did not even know that they've had an infection and find out later that they've got antibodies because they were exposed, didn't know they had it, and may have had it. And people who thought they were protected, and when they measured their neutralizing antibody levels were perhaps too low and likely needed a booster, or people that were infected who were perhaps too low and likely needed a vaccination. And again, are people that have had those and have adequate antibody levels. We know there's a lot of concern, particularly from a lot of our members who are here in the General Assembly and from a lot of our constituents who have had an infection already and are being required as part of either from an employer or from someone else to have a vaccination as part of their employment. We're not affecting that in this bill. We don't want to do anything that's going to tell a business whether or not they have, if they make that a condition of employment. I'm not interested in making policy that's going to get in the way of that. However, I think it is important for us as a state, because there are other international governments in particular that recognize people who have had a previous infection and an antibody response to be equal to being vaccinated for entrance into their country during this time. And so I had drafted this resolution where you can see all the whereases and the conditions at the beginning of the resolution, but at the very end where you see it, be it resolved in the 3 sections, that again, in accordance with the national standards for vaccinations, the Commonwealth of Kentucky and any agent, agency, authority, board, bureau, commission, department, division, or other entity of the Commonwealth of Kentucky shall recognize individuals, including but not limited to state employees, whose serology test results show measurable neutralizing antibodies to COVID-19, quantified above the 20th percentile of the population of immunized individuals, as equivalent to being fully vaccinated against the virus that causes COVID-19. People are going to ask, can I just go get a simple antibody test and I've got them present? Is that sufficient? That doesn't measure quantitative or the actual number of antibodies. For people that have got antibodies already present, if you're in the bottom 5th of those people of lower antibodies, we're going to say for the sake of the state, at least for the next 4 months, you probably don't have adequate immunity. If you're in the top 80 percentile, or the top 20th percentile, but top 80% of people who have got antibodies present and you've got measurable antibodies where you can show, my lab results show that I've got an adequate response, that we're going to consider you as having been vaccinated or the equivalent of that. And again, we heard some good testimony, had a lot of questions. People, this is not something to say you shouldn't get vaccinated. I think if anything, it might make some people alert to the fact that they've had the infection and probably don't have adequate protection and need to get vaccinated. People that have already been vaccinated who might need boosters. People who didn't know that they had been infected and may have an adequate antibody response, already been exposed. And so it might alert some folks to proceed with that. But then others who have already had a natural infection are not interested in taking the vaccination to allow them to be considered the same. The CDC has put out studies, as has really the country of Israel, which has done a lot of studies in this regard, who have found that people that have been naturally infected and survived often will have a stronger antibody response than those who have been vaccinated artificially. And so in honor of that, because there are individuals out there, particularly medical providers, I've talked to physicians and nurses who have had the infection already, but are leery of taking the vaccination, don't want to, and saying, I've already got a natural immunity, shouldn't I be allowed to count that as a vaccination? Scientifically and medically, I would have to agree. Now, how long does that immunity last for? We don't know. We're still learning as we go. We know we're covering the original variant and the current Delta variant, and that's why this bill is only good, really, until January I think I put the date in here, 31st, I believe. January 31st of next year. So until we return, January 31, it's in Section 2. It's going to expire once we're back in session. Because if we have a new variant like Lambda or Mu variant, and we find out later that, hey, your antibodies that you've gotten from vaccines or from the previous variants of natural infection no longer cover that, we don't want to make this a permanent type of exemption. We know that when people catch the flu every year, you're supposed to get an annual flu shot. Why? Because you may have had immunity from the flu last year, but if it mutates to a different bug, your previous immunity doesn't cover it. You should take a shot for the flu every year. This is probably going to be the case for COVID moving forward, depending on how long that immunity lasts for. So we wanted to make it sure that we covered it. There's a lot of folks out there. We're not obligating our employers. We know there's a lot of employers that are requiring vaccinations. We're going to recognize this for the Commonwealth and for the agencies under the state and the Commonwealth. I don't believe that we're obligating any state employees or anything along those lines. However, that may become the case if the executive branch wishes to require that of state employees. We want to make sure that we provide at least those who have had an infection an opportunity to say, I've got enough antibodies, I'm protected already, and that would count until January the 31st when we return. I've already gotten several texts from private employers who are concerned this is going to require them to do it. It doesn't require them. They're going to have employment standards for their employees. However, if somebody has a natural immunity, I would hope it would encourage them to at least think about that, as we would with a lot of other infections, that if someone already has antibody levels that are adequate in a measurable quantity, then they should be recognized as being equivalent to being vaccinated. I'm sure there's lots of questions. I'll be willing to entertain any that you might have. Senator Givens.
Mr. Chairman, thank you. And you and I have talked about this legislation some. And if I'm not mistaken, we had a lengthy committee meeting in the prior week with an hour or more of presentation on this topic. So this is not something that's coming anew to us in this moment.
That's correct. We had an hour meeting, and there was an article that was referenced because I think the question was made of the lab, how did you come to that conclusion? They said there's a white paper that's been produced. This is a very reputable medical journal, and it does produce a lot of this information. Like I said, the CDC has also recognized natural immunity as being, I think there's been several articles published recognizing that it's strong, that natural infection you have the antibody response is stronger than vaccine. However, again, the risk of catching a natural infection is death and major medical complications from it. So I encourage folks, despite that, not to say I'm going to wait to catch a natural infection because you probably have a bad outcome. You may have a bad outcome from it, either death or clots or different things that can occur from this virus. I'd encourage you still to get vaccinated. But I think it is important that once you've had the infection, if you have an adequate antibody response, at least in the short term, that should be equivalent to being vaccinated.
Chairman, is there any mandate for any individual to undergo any form of testing as a result of this joint resolution?
No, there is no requirement. Again, this would have to be something that the state's not going to pay for this test. An individual would have to find a way to pay for it. I'm not sure if their insurance may be covering it as well, but they would likely have to find a way to pay for that test to get that done. And again, then they can use those results based on that. So,
Mr. Chairman, based on what you're saying, there is no mandate that any entity of government pay for this testing?
That is correct. No mandates to government to pay for them. There is no mandate to private employers to recognize it either. This is just as the state is going to recognize this with regards to state agencies.
Last quick question, if I could, Mr. Chairman. Some have reached out to me concerned about how this could impact incentives within an organization of state government for promoting vaccination. And the concern being that a positive COVID test somehow places someone in this category. And as I read the language, and as you've indicated, a positive COVID test and a measurable neutralizing antibodies test quantified above the 20th percentile of the population are not the same thing.
State that question again.
If someone tests positive for COVID, that test is a different, totally separate test from someone who's going to be testing to show measurable neutralizing antibodies quantified above the 20th percentile.
That is correct.
So anyone out there that may be concerned that a positive COVID test may check the box as success toward vaccination, entering into a vaccination promotion contest of some kind. That is not the case.
That's correct. So just because you have a positive COVID test, again, and as we heard in the testimony a couple of weeks ago or a week and a half ago, you could have had a positive COVID and people got their blood levels checked and said, whoa, I have a very low antibody level. I have a response. So if you go get the quick little test that shows a line that says, hey, I've got antibodies, but you may not have enough antibodies. And that's why we're still hearing a lot of medical professionals saying, even if you've had the infection, they're encouraging people to get vaccinated. I'm a case in point. I picked up COVID before the vaccinations were available. Once the vaccinations were available, I took the full vaccine series. I've had my booster already as well. And so I've gotten, I'm full of antibodies. I certainly hope. I haven't had my blood levels checked, but it's because of that risk. Someone can have an infection, think they're protected. They may not be fully protected, but again, if you get it measured and if it's a quantifiable level, it can't just be having the infection. You're correct in your assessment, sir.
Last, if I could, Mr. Chairman, and I promise, because you're the voice of authority on this committee, I'd like for you to speak publicly into the camera and talk about the value of vaccinations.
Certainly, and I've said it before in our committee hearings, and I've said it in my district. I've published articles, which unfortunately some of our newspapers haven't been willing to put out there. But I'd encourage people, and this is something that I feel very strongly about. Some people have heard my remarks on the floor today, being critical of the governor and his approach. That shaming people, whether they wear a mask, not wear a mask, whether they get a vaccine, not get a vaccine, all that, again, the political rhetoric on both sides is not productive here. If people are concerned, if you have questions, go talk to your doctors, go talk to your nurse practitioner, whoever's in charge of your medical care that you trust with your healthcare issues. Go talk to them, ask them the questions, relay the concerns that you have, let them discuss this with you. And some people, it's an immediate conclusion. Yes, I want to get it. Others, it may take a long time. Others say, I don't want to do it at all. But I encourage you, go have the discussion there with someone that you trust, not with someone who's politically inclined. I fear that we've lost the narrative. And I think government tried to do what it could in terms of encouraging, and some people responded, but the usefulness of that has been expired. I would encourage people, really, if you don't think that COVID-19 is real, I can tell you that I've been doing this now for quite a while. There's been a lot of viruses we've encountered, a lot of people that can get sick, and lots of viruses. The common cold is something that we encounter that can make people very sick. They don't think much of. But I've watched a lot of influenza year to year to year. People have gotten used to the influenza virus, and they think it's not that big of a deal. Influenza kills a lot of children every year. It kills a lot of adults every year. I've seen it kill my colleagues who aren't protected with vaccines. So we encourage influenza vaccines every year. COVID is a brand new virus. We're learning as we go. And because we don't know everything in full detail, we're encouraging people that, again, just because you've had the virus doesn't mean that you're necessarily fully protected. So if you're uncertain, if you want to get a blood test, you can get that. But if you don't want to get that, I'd encourage you to take the vaccine. For those of you who have not had the virus, please get the vaccination. Mathematically speaking, no matter what you're looking at and all the risks of taking a vaccine, mathematically speaking, getting the vaccination makes sense because it does reduce your risk of hospitalization, serious illness, and sudden death. And it also helps, again, once you get that and you're protected, it'll typically reduce your risk of transmitting that to others as well. So I would encourage everybody out there, please get vaccinated. And that's as simple as I can get it. Thank you. Senator Carroll.
Thank you, Mr. Chairman. And I would add to that, I had the opportunity to meet with administration, the chief medical officer, and others from Baptist Health Paducah the other day. And during our meeting, we got into a conversation about the history of the vaccine. And I did not realize that this vaccine has actually been under testing for many, many years. And once they explained the process to me and how that they have researched this and it has been tested, that they were able to adapt to the current COVID-19, they were able to adapt that vaccine to fit this particular pandemic. And so when I left there, my first question was, why doesn't everyone know this? Because I even had a higher comfort level after I heard the doctors talk about the history. I guess mRNA, is that? Yes. And so that's a message that I think our people need to hear more of, perhaps to get a little bit more comfortable with it. And really that information needs to come from the doctor, and that's really one of the reasons why the physicians need to have access to the vaccines in their office. And I know we're making moves in that direction. I think that's going to be very helpful. My question for you, Mr. Chairman, is with this type of testing, will every lab be able to do this testing? And would a patient just need to walk in and tell their doctor that I need a quantifiable test, antibody test, and ask specifically for that type of test? And with that being said, will they have to search for a lab that does that, or would each hospital that has a lab be able to do that type of testing? That's
a great question, and I haven't researched to know how many do them, and we heard of one that came and presented here in committee. We do know that. I had someone reach out today and mention that they think Kroger's has 2 tests, that people go to Kroger's sometimes for testing. They can get just a qualitative to see if you've got antibodies present, and I informed that person that's not going to be adequate to fulfill the requirements in this document. You'd have to get one that's quantifiable, measured quantity. They said there's a more extensive one that could be done, and if they can measure that and give you that in that top 20th percentile and above, that you could qualify for this. So you'd have to find a lab that could do that. It's not just a simple finger stick. It'd have to be a blood draw and measurable antibody levels. So if someone really says, hey, I've had the infection, they want to go out of their way to make sure they're really that adamant about getting the vaccination, then they can use this as an alternative. But how many labs are doing this, I'm not certain. I do know that there's at least one in our state, at least in my district. I would imagine there's others who can do the same thing. To your point on the messenger RNA, I know there's a lot of information on Facebook out there about who invented this therapy. And I'm going to put this out there. There's a Hungarian biochemist. Her name is Katalin Karikó, is the person who invented this. Very interesting story if anybody wants to read about her. She was in a communist-controlled country in Hungary, was developing messenger RNA technology. Her ideas were dismissed by the general medical community. And they said that will never work. You can never produce a complex antibody through a messenger RNA technology. And she was just dismissed. She fled Hungary with her husband, I remember she had a daughter's teddy bear, some money stuffed in that teddy bear to survive, and escaped that country at that time, and then came to the United States, where she kept pushing her idea and her concept, and now it's a breakthrough effectively for the world in terms of vaccinations for the Pfizer and the Moderna and anything that's messenger RNA technology. We do have 2 types of vaccines, I remind people. So the Pfizer and Moderna types require very cold storage, which a lot of our doctors probably can't do. But Johnson & Johnson is one that's more of a traditional vaccine like you would see from a flu shot, where they take a portion of virus and splice it into an adenovirus, and then your body recognizes that portion, mounts an antibody, and produces a response. And those are the types that our doctors could probably go ahead and use. So that's more of a traditional vaccine. It's one-time shot. Pfizer and Moderna is a series of 2 shots that she helped develop. And there's a lot of misinformation about who's taking credit for that. She's the individual who really came up with the idea. Very interesting story. Again, another example of an immigrant who really helped advance things in America and in the world, which is really kind of neat.
With all the concern about everybody's saying how this has been rushed, the reality of it is it really hasn't been rushed. It was already there.
The technology was there. We just didn't think it would work. And then once they got it to work, then we rushed it to say, hey, we want to do this. And again, over 169 million people in this country has received this vaccination. Anything that you get is going to have a potential side effect. Nothing is 100%. A lot of people say, well, if it's going to protect you, how come people are still getting infections? I think this resolution goes to that people can develop antibody levels that are not adequate. And so if you have lower antibody levels, you think you're protected, you get a secondary infection on top of that. Also, the fact that's why we're recommending boosters for a lot of this is that sometimes you need to have a bigger response. So you've got a different technology to manufacture that antibody. We may be requiring those to maintain your antibody levels high enough than using a natural immunity model. Dr. Berg.
I have several questions, please, if I may. What other states are using this, neutralizing antibody levels in lieu of a vaccine requirement at this point? Do we know?
I'm not aware of any. I think we might,
So
might be the first. Yeah, this is something that I developed specifically for this session, so I'm not sure of anyone who's got this language.
And this article in Nature Medicine, which is from Australia, I believe, are they doing this in Australia at this point?
I'm not sure.
Okay. So we would be the absolute first.
I would imagine so. I don't have the answer for you. I'm not sure if other states are doing this. I just do know that based on sound medical knowledge of immunology and how our immune systems work, we develop natural antibody levels to infections. And so
right.
I'm trying to be responsible by not making this a perpetual thing. It's just for the next 4 months until we return again. I'm hopeful that these new variants that are out there don't catch wind and start causing other surges, but I suspect the way this virus is starting to behave, we might see that in the future. So I wanted to be responsible about limiting it just to a very short time frame.
All right. So if I may, on my article's not numbered, but in the testimony that we got last week, that gentleman who was, I thought, fascinating. I mean, basically was able to demonstrate that in his this was a very small, I don't have it in front of me, but I believe it was only 30 patients in that one sample group, and those with native infection had a general antibody level of 23, whatever the 23 means, and those that had a native infection and had been vaccinated, their antibody levels jumped up to 40. We're saying using that same, and I don't know what we're measuring here. I don't know this is 23 millimeters of mercury. I have no idea what we're measuring. But you're saying that we're going to continue, we're going to say that 20 is adequate to show that you've had a prior infection. And if you've had a prior infection, then we don't need to vaccinate you, is what we're trying to do here. Is that
No,
correct?
not at all. Not at all.
Okay.
And we're not saying, and again, what it might actually do, doctor, is that there might be people out there who think they're protected, who've said, I've already had the infection, so I don't need a vaccine, and I want to make sure, so I'm not, and they'll go and get the test and realize, oh my goodness, my levels are too low. So we're actually going to say, if you're below us, you may have had an antibody response, but you're not protected in that situation is what we're kind of trying to argue, that you should consider getting a booster. So we're not saying that you don't need to have a vaccination, not at all. Again, I would encourage people to get vaccinated. People often ask me, if I've had the infection, do I have to get one? I'd say it's recommended. It's not going to hurt you to do so. But there are some who are adamantly opposed to that. And so then the question becomes, all right, if we're recognizing people that are vaccinated as being protected and reducing the risk of transmission, people with natural infections in the same reaction in their bloodstream and the same reaction in their immune system and has an adequate level should be recognized as the same thing. And that would apply, again, I use the example of chickenpox. If a 6-month-old child came to see me in the office and they have the chickenpox, you would treat them for the chickenpox. When they're due for that shot at 1 year of age, do I give them the vaccine for chickenpox? I don't need to, because they've had a natural infection and they're protected. And that's true of anybody who's ever had the chickenpox, is once you've had it, you have essentially lifelong immunity. So it applies the same way. We know this is a novel virus. I'm not saying this is going to be a perpetual thing. I don't know if there's going to be a lifelong immunity. We'll learn more, I'm sure, as we go. For the first 2 strains, it appears that a natural infection is probably stronger antibody response than vaccinations are, which is why I think we're seeing a lot of folks that are getting reinfected, sometimes with the vaccines. But however, all that being said, getting vaccinated, we do know. I mean, you look at our hospital census right now, it's a 10, 11 to 1 ratio of people that are unvaccinated who are deathly ill from those who are vaccinated. So again, it behooves everyone, go get a vaccine. That's what you should be doing. There are those who are not, and there are those, and so I wanted to just recognize that in this resolution, that for state employees, state agencies, we're going to recognize that. I'm not aware of any state agencies that are being required to take vaccinations, but we're going to recognize people that have a natural antibody response, at least for the next 4 months, to have the equivalent.
All right. If I may, sir, Chairman, there's some things in this article that reflect my actual pre-existing knowledge base. And I just, for those of us that in this room who aren't practicing medicine, I just want to bring them out. And these pages aren't numbered, so I can't refer to the numbers, but it basically says an important caveat to this analysis is the implicit assumption that neutralization titers itself confers protection from severe disease or severe infection. And guys, we don't work on assumptions in medicine. I mean, you can hope, you can pray, you can think, you can test, you can prove, you can confirm. But as of this point, we do not have conclusive scientific data available to us that shows that your level of antibody response in any way correlates with a definite immunity to infection. We just don't know that yet. I mean, we would like to know that. We want that to be true. We would love to know that, but we don't. And this article, clearly says an important caveat is the implicit assumption that neutralization titers itself confers protection. And then it goes to the next page and it says, understanding the relationship between measured immunity and clinical protection from SARS-CoV-2 infection is urgently needed to plan the next steps in the COVID-19 vaccine. Could I very respectfully suggest that we hold off until January on this suggestion?
Well, and you're entitled to your opinion and vote. I would argue that this same technology of measuring neutralizing antibodies is how we've confirmed immunity with the use of the vaccinations that we're recommending now. So, if the argument's going to be that this natural immunity, we have to be careful, we're recommending vaccines for people, how are we confirming that people have immunity? And how have we confirmed that the vaccines work for Pfizer? They measured their neutralizing antibody levels and confirmed that there was an adequate response. So the same definition that we use to make that vaccines work is the same definition we're applying to this. It's exactly the same. So there's been, and again, if we're going to say, well, there's no connection, well, then you would argue that the vaccines are not effective, which I would argue that they are because they've had an adequate neutralizing antibody response. If you look at the technology of how they've measured Pfizer, Moderna, Johnson & Johnson, how do they work? We measure your neutralizing antibody levels after you've been administered the vaccinations. If people have an adequate response, that's considered to be immunity to it. So it's the same technology being used for vaccinations as it would be for natural infections. Senator Kerr. Senator
Can I
Kerr.
respond?
Well, if you'd
May
like to
I
have another question,
respond?
sure.
On the last page of the article, it clearly says, the association of neutralization with protection across these studies does not prove that neutralizing antibodies are necessarily mechanistic in mediating protection. It is possible that neutralization is correlated with other immune responses. We don't know. We know what we're measuring. We know that we see it in people that have had native diseases, and we know that we see it in people that have had vaccinations. We can't just assume, because they're true, that not only they are related, but what the significance of the relationship is not, we can't just, because we wanted to say, oh, you're safe, we can't just say, oh, the data says you're safe. The data has not gotten to that point yet. Let's wait 4 months. People are exploring this on a daily basis, but we're not quite there yet. My experts texting me during our last committee meeting, texting me now saying, Karen, stop this. Don't let this go on. It's not good enough yet. I can only rely on what I know, what I've been taught, and what experts are telling me. And these are immunologists from all over the state who are telling me, we're just not ready. Let's work on getting vaccines in arms. Let's work on getting our constituents less scared of us as healthcare providers. Let's work on letting them know that the technology for this vaccination was developed long before this virus ever was unleashed on the earth. We've been working on this technology for years and years. And guys, the good news is we'll be able to replicate it. With the next virus, we can use the same technology. We can come up with another vaccine. It's not going to do us any good if we can't convince people to take them. So instead of giving people excuses, I don't have to get vaccinated. Maybe I'm already immune. Maybe I'm not. Who knows? Let's jump up and down and try to do everything but face the truth, which is that vaccines work. Let's encourage people to get vaccinated.
Thank you, Senator.
Thank you.
It's not saying that it doesn't work. And again, we're not mandating anybody to do anything.
I understand.
We're recognizing that the assumptions were made when the vaccines were authorized in an emergency fashion by the FDA, where we didn't know either. And we said, but the preliminary data looks pretty good. So we issued that ability because we measured neutralizing antibody reactions to the vaccinations that were being administered. The same technology is applied to our natural immune system vaccinations that were being administered. The same technology is applied to our natural immune systems where if someone has an exposure and you've got adequate protection, it provides the same protection. Senator Kerr.
Thank you, Mr. Chairman, Dr. Alvarado, and I appreciate so much you bringing this today. I think it's really important. I think here right now we saw a demonstration of how even scientists and doctors can kind of vary. I don't think you all really are apart much on that. You both agree everyone should get vaccinated, and you both agree that probably everyone should wear a mask. I'm just a grandmother and a wife and a mother. I'm not a doctor, I'm not a lawyer, but I can tell you anecdotally that my husband and I, who are in our middle 60s, got the vaccinations and then got the Delta variant. So probably the Delta variant was my booster shot for now. That's what I'm being told. But again, it is so important that we get these vaccinations because my husband, who is in his middle 60s, got the 2 vaccines, got the Delta variant. And it was not a mild case of the Delta variant for either us or our 2 grown sons. My husband's pulse ox got low enough that had it stayed where it was for another 3 hours, we would have been in the emergency room. So please understand that this vaccine has been studied longer, as Senator Carroll pointed out. It's been studied for a while. And I plead with you as a grandmother and a mother to go do everything you can to get vaccinated, to stay masked, and to listen to the opportunities to do the things we need to do between now and January and then thereafter. So I thank you very much, Doctor.
Thank you, Senator. And really, I'm glad you bring up the point. Like I said on the floor, medicine is not 100% black and white. That's why we have second and third opinions from other providers who might give you other opinions on things. People will interpret data however they want to look at it. But again, I think there's international studies that confirm, the CDC has confirmed that natural infections probably provide you a bigger booster of antibodies. But again, I don't want people to be fooled. You could have had the infection and be susceptible to catch it again. We've seen that happen. People that have been vaccinated could be susceptible to catch it again. That's why they're going to be recommending probably boosters for those who've been vaccinated in the future to continue to boost your immune systems to that regard. I think if anything, this resolution might get some people tested and realize, oh my goodness, I'm not as protected as I thought I was. I should go get a vaccine as well. Senator Nemes.
Yes, thank you, Mr. Chairman. I think I'm going to reiterate a lot of what you said. I love the passion of Senator Dr. Berg for the vaccines, but I think vaccines in themselves are not proof that you're sufficiently protected. And if you take an antibody test, they may show that. And I think you've alluded to that or just stated it. And another thing I want to point out is Senator Givens talked about is that a positive test of COVID is not acceptable. It is an antibody test that you need. So I like that we are encouraging people that don't want to get the vaccine to get an antibody test. That can actually show where they're at better than even getting the vaccine. So thank you.
And to that point, Senator, even just having an antibody doesn't mean that you're necessarily protected according to this resolution. So people will think, oh, I'm just going to get a finger stick and have a little line that shows, hey, I've got an antibody. No, that's not enough, at least not from my resolution. You've got to have a measured, quantifiable amount, and you got to be kind of in the top 4/5 of the population out there of antibody levels to say that we consider you equal to be vaccinated. If you're in that lower fifth, we're going to say that's not sufficient. We're not going to consider you. You might have to go get, we're going to recommend that you go get vaccinated.
And once again, we're giving an alternative to those that don't want to be vaccinated. We are still encouraging being vaccinated, even if you have had COVID.
That's correct. And I would encourage everybody. We're a lot of us are politicians, whether we like it or not. And Dr. Berg, I know we kind of probably, as doctors, that's kind of a more noble title for us. But nonetheless, it's because of that, people don't listen to us as much. They'll try to find a reason to disparage one side or the other. I encourage people to go talk to their doctors, go talk to the people that you trust with your health care and have a discussion about this. And I'm certain that they will guide you properly on the best course of action, which in my opinion is to get vaccinated. Any other questions from members of the committee? If not, I will entertain a motion on the resolution. There's a motion. Is there a second? We have a second. Any other discussion or questions? Madam Clerk, please call the roll.
Senator Rocky Adams, Senator Berg,
I'm going to vote no, and I would like to explain my no vote.
Please
because
proceed.
I think this would be amazing if the science were more solidified. If we had the data that shows that, yes, we know that this number of antibodies means this, and what type of antibodies, and what, I mean, I really wish we would wait until January. So I'm voting no now. Thank you.
Senator Carroll,
Aye.
Senator Givens, Senator Harper Angel,
Explain my vote, Mr. Chairman.
Please proceed.
Mr. Chairman, I'm going to have to vote no today. With all due respect, I'm just worried that this adds a level of confusion that we just don't need in terms of being vaccinated or any information about that at this point. Thank you.
Senator Howell,
Aye.
Senator Kerr, Senator Meredith, Senator Nemes,
Aye.
Senator Wise,
Aye.
Chairman Alvarado.
I cast an aye vote. I'll explain my vote also. If we waited for the science to catch up, we would have never developed the vaccines to begin with. We'd still be waiting on a vaccination at this point in time. The final tally is 8-2, and the resolution passes a favorable expression to the Senate floor. Any other matters before this committee? If not, we stand adjourned. Thank you.